talk to consultant neurologist Dr Mike Barnes, who joins us now. Good to see you this morning.
Good morning.
Is the PM right, first and foremost, to say the waiting list issue is, well, if not caused by, at least considerably exacerbated by the strikes?
Well, you can't deny it's exacerbated by the strikes, but you've got to look back as to why they're striking in the first place. And I think people are striking in the NHS in the first place because of the relatively poor pay and increasing stress levels, increasing overwork, and people now want to be remunerated properly for what they do. And all that work can fall back to is sadly striking. If the government really wants to do something about this, they need to address this issue quickly, negotiate with the doctors and other health professionals over pay, get people back working, and then slowly chip away at those waiting lists. Otherwise, if we don't do that, we will lose a lot of people from the NHS, and that's a self-fulfilling prophecy, isn't it? More people leave, more work on those left, etc.
What needs to be fixed in terms of the conditions that NHS staff are working in? You know, the reasons that they were striking in the first place, as you say.
Well, I don't want to be too simplistic about it, but a lot of it comes back to money, to be quite honest. The overwhelming majority of people working in the NHS want to work in the NHS. They like the concept of NHS. They feel they're doing a good job and a worthwhile job. All they really want is to be paid properly for that job. That will keep them in post, and slowly then, with more recruitment and more money, we can recruit more people and chip away at those waiting lists. And I think any new government, and it looks like we're going to get a new government this year sometime, is please just put some more money into the NHS. Don't fiddle with it. Every government coming in has some new whizzy plan to redesign the NHS. Please don't do that. The people in the NHS know what they're doing. Give them the money to do it and let them alone.
I've got to say, I mean, it's the first time I've ever heard anyone say that. To be over decades, to be fair. Just put more money in the NHS and don't fiddle with it. I mean, the reality is here that the NHS is not working as efficiently as it should be. It does need to be streamlined, doesn't it? It does need to be more efficient.
I honestly think that the people working in the NHS know how to run the service. The doctors have been doing it, the nurses have been doing it, the therapists have been doing it for years. They know what's best and how to run the service. Just give them the resources to do it, and please don't keep fiddling with it. If there was a magic solution, then surely governments over the decades would have found it. They haven't found it. Governments have fiddled with it, made it a little bit better, made it a little bit worse. Just leave it alone, put money into it to make it work properly, and that will help the problem.
Really interesting. How much do you think staff retention would help matters when it comes to waiting lists? We hear this morning that half of NHS workers are looking for jobs outside of the NHS.
Yes, sadly, that doesn't surprise me. As we've said, there's a lot of work in NHS, there's a great deal of stress in NHS, long waiting lists, difficulty to get access to those services. There's a lot of abuse comes to the staff when they've been sitting in casualty departments for 10 or 15 hours. You know, it's not an easy job. People want to carry on working in the NHS, but I really do think that putting more money to help the staff there already and to recruit more staff would not solve the problem. It's not that simple, but would simply help the problem. The terms and conditions in NHS aren't bad, frankly. You just need to retain the staff. And retain the staff, you need better working conditions and better pay.
The problem is that many people have argued this, of course. Isn't it just a bottomless pit, the NHS? No matter how much money you put in, you look at what it's costing us now, and you look how much money has been put in over the last 15 to 20 years, and whatever you put in, it's never enough.
There's an element of truth in that. I agree. It's a very expensive way to run a health service, and other countries run on more insurance-based schemes and such like. But if we want the NHS as it is, and I think most people in the country probably do want the NHS as it is and not revert to an American or a European system, then sadly it's going to cost money. It's not a bottomless pit. It's a big pit, but it's not a bottomless pit. And I just think some more money would help the problem enormously.